This programme is brought to you by UCKG.
Welcome back. On today's show, a hairy topic. We've been discussing how well we look after our hair, right? And joining us in the studio today, we have trichologist Natasha Dennis. Welcome, Natasha.
Welcome.
So when I heard that we were receiving a trichologist on the show, I had, I'm sure, a question that most of our viewers have. What does a trichologist do?
Yeah, it sounds a bit like an alien. But basically, a trichologist is just a hair specialist. So what we do is we diagnose hair loss and scalp conditions.
Alopecia.
Yeah, alopecia, you know, flaky scalps, anything from infections, anything to do with the hair and scalp. We basically diagnose it and give advice and treatment. So,
okay.
Yeah.
You know, it's funny because as you were talking, I thought, what makes a young girl think, oh, when I grow up, I'm going to be a trichologist?
I get asked that all the time.
True?
No, I get asked that question all the time. I know it sounds a bit weird, but I think it was something that I'd always been destined to do. I've always been interested in hair and scalp conditions. I did a stint in a salon for probably just the summer, just to do like hairdressing in the salon. And I just wasn't interested in, you know, like the cutting and the colouring and things like that. But I found myself at the basin putting conditioners in and trying to moisturise the hair and make it better. So, I eventually found trichology and, it answered everything that I wanted to do. And I took the course and, here I am.
And here you are.
Wow.
So you wrote this book, The Beginner's Guide to Afro Hair Care.
Yeah.
What inspired that book?
There's a lot of really, really good books out there. But I think for me, I wanted to have something that someone could pick up and they would know exactly how to look after their hair after reading it. So how many times a week to moisturise, how often they should wash their hair, you know, everything from just being able to maintain it and look after it. They'd know exactly what to do as soon as they read the book, even when it comes to products, what products to use on the hair, things like that. So that was really the goal with the book, and then possibly the next step being to start getting people to build a relationship with their hair, because that's the foundation of, you know, having great hair throughout your whole life. So
So needed, isn't it?
I love the fact that you're mentioning that we have a relationship with hair. It's not something that you would think about, like, I relate to my hair. And I can relate to that because I don't have a healthy relationship with my hair. I think I kind of neglect.
Naughty.
And now that it's natural, it's kind of easier to neglect because I don't need to put a lot of work on it for it to be ready. Yeah. But so it's something for us to pick up. We have a relationship with our hair.
I love that.
I'm starting to build a relationship with my hair now. So I'm sure you get a lot of people coming to you for advice, and you know, what's the most common thing that you get people coming to you for?
I would say more now stress-related hair loss. When I first started in clinical practice, it was traction alopecia, which is hair loss caused by tight pulling. Today, more and more women are highly stressed because they've got to work full time and they're working over the normal hours, especially in Europe. They've got children and then they have to, you know, after work they come home, they have to cook, they have to clean. They might have a husband or a partner, so they have to tend to them as well. And then you've also got your friends and your family. So I think as women, we're pulled from all different corners, and it does reflect itself in our hair. You know, they say that hair is a barometer of our health, and it really is, because whatever's going on inside the body, if there's any change going on, it does reflect itself in the hair. So I'd say a lot of hair thinning coming through these days, purely from stress on the body. Even when you're enjoying what you do, the body can still become really, really stressed because of that. So,
and so many people suffer from this alopecia. I mean, is there an actual, because you see people who have alopecia, they spend like years without no hair follicles. And does it actually hair grow back? Is there an actual treatment for that?
Yeah. Is this the smooth patches you're talking about?
There's circles, or some go completely bald even.
Yeah. It depends, because you've got a condition called alopecia areata, and that's considered to be an autoimmune condition, which again is brought on by stress. Vitamin D a lack of vitamin D may also play a role in it as well. And it tends to be an unpredictable condition, and those are always the most difficult ones, not so much to diagnose, but when you're providing the diagnosis to the patient, because you're saying to them, okay, it may grow back, it may not. What I find is that when the person takes their mind off stressful situations and they're kind of consumed in something that they like a hobby, the hair does tend to spontaneously grow back. The only thing is that it can sometimes grow back grey. Not all the time, but sometimes it might grow back grey, or it might grow back a bit curly, or just a different texture. Completely different texture. Yeah.
Look at that. I mean,
go for it.
Are all conditions scientifically treated?
Not all of them.
Or natural, even?
Yeah, some of them, for example, you've got genetic hair loss, and that's predetermined before you're even born. So at a given time, normally puberty, the hairs are going to revert to being small, and then obviously you can see the signs of hair loss. But there are other conditions which can be emotional. So sometimes you've got people that may consciously or subconsciously pull their hair out, especially if you're at university, you're really stressed because of exams and, just a lot going on in your life. So that can be, emotional. But I think always when it comes to hair loss, there's always an emotional side to it, because just the fact that you have hair loss in the first place is really, really upsetting. So that can then lead to more hair loss, so it's almost kind of, people that are suffering from hair loss, they're almost in a vicious cycle, because even if it was scientifically caused to begin with, there's the emotional side of it. I think it's important to really understand and put yourself in that person's position. And sometimes just advice in itself is a treatment within itself. Sometimes people just need someone to talk to about their life and what's, going on. So, I think that's the first best approach to treatment, and then obviously looking at what you can prescribe if there is anything.
I know, it will depend on the problem that a person has, but on average, how long does a treatment last? So if someone comes with a problem and they come out with a solution, how long does that process last?
It does vary. You said it correctly, it really does vary. Everybody's hair is different, and whatever the problems are will be different. So for example, when it comes to stress, I'm really, really honest with patients, and I will say, until the causative factors have calmed down or they've been taken out, the hair loss may remain until then. If the condition is treatable, it's not stress related, maybe you had a tight hairstyle in and you took it out, the hair instantly fell out, that will probably start to come back in a couple of months. It's just a couple of inches each month, and then you'll get the full amount of hair within 6 months to a year. So it really does depend on what type of hair loss the person has and what actually caused it. And then once you're able to establish the cause of it, then you can say, okay, we're looking at this time frame or that time frame. And then obviously, of course, with things like alopecia areata, where you've got the smooth bald patches, they can be very unpredictable. So they might come back in about 3 months, or they may take a bit longer, to start coming back.
Some people actually, even with their children, they get worried because after a certain age, is it lanigo? It's called the baby hair. It falls out. So some mothers actually get really frightened because that baby hair falls out. But it's natural, isn't it? It's very natural.
Now I'm going to ask a question that's for my friends out there, because I have friends who are obsessed with length. They're obsessed with length, and I know some, for example, they've been trying to grow their hair and it's not growing. Is this something that a trichologist would be able to help them with?
Yeah, I do get clients that come to me about when it comes to length and wanting to grow the hair longer. And there's 2 very simple things that you can do. The first one is moisturising, which I know that you mentioned at the beginning. You don't like doing it, but it does need to become a staple part of your hair care, just like brushing your teeth and washing your skin. Moisturising should be as natural as that. it should just be a part of your life. And then the second thing is gentle combing. So we do have a tendency to take the comb and just kind of pack and pack back the other way. But when you comb gently and you're moisturising the hair, you can start to get a good amount of length out of it. So I think that's the best bit of advice I can give, doing those two things to start with. And then, of course, sometimes the hair may only grow to a certain length. So once you've kind of gone through that process and you've given it a go for a good couple of months, 3 months maybe, and you're still not really getting that length out of your hair, it's important to kind of look at, can my hair actually get to the length that I want it to? And of course,
I find it quite strange because they say that hair has that length span that they say, but then you see somebody who grows like locks, and the locks grows right down down here. What do you say? That is so strange. Why cannot she could just grow her hair down there? How comes it's just isn't that strange?
Yeah, that is strange. Yeah. Can I just ask about moisturising there, because I know you touched on it, and that's a big thing, especially for Afro-Caribbean women, because it's like they could get their grease out, for instance, like, okay, let me grease it all, make sure it's shiny, I'm moisturising it. But there's certain products that I hear that you should avoid, certain products that have certain elements in it that you should avoid completely because it will weigh down your hair or break your hair. What is the best way to moisturise our type of hair?
Yeah, so moisturising, whenever you're thinking about moisturising, always look at what you do with your skin. So we cream our skin or we lotion it. We don't, probably in the last few years we started coming out with fancy oils and things like that, so I take exception, but generally speaking we cream our skin, and cream in itself contains 80% water. In fact, the best creams contain 80% water, and then you've got kind of like the oil and the wax that blend it together, which makes it white. But cream in itself, if you look at a bottle of cream, what you're really looking at is a glass of water. And so creaming is the best way to go about moisturising your hair, or a moisturising spray that's water-based, or a lotion. And it really depends on your hair type and texture. So, if you have soft hair, you probably want to use a spray. If you have medium textured hair, you could use a spray or a lotion. And then if you have coarser hair, which is a little bit drier, maybe slightly a bit wiry, doesn't display all of those characteristics in one, but it will have some of them, then maybe you'd not want to use a cream. And so I would probably recommend that. And then if you want to use a bit of oil, you can use a very small amount to actually lock that moisture in. But oil in itself is not moisture. It looks moisturising because it's lovely and shiny and it looks nice on the hair. But you can always tell if the hair's been moisturised by touching it. And you find that the grease tends to come off in your hands if you put your hands through the hair, it comes off quite easily.
Because I actually use a lot of coconut. My hair's actually very soft. Soft hair. So I use actually a lot of coconut oil in my hair.
It's lovely.
So is that, that's good, because it's a natural product.
Yeah, you can use it. And if it works for you, I think that's the most important thing, because you don't want to change something if you find that your hair, is soft and it's doing the job. But if you felt that the hair was still a little bit dry, you could maybe put your moisturiser on first and then put the oil on after. And so the oil serves two purposes. The first is to lock that moisture in for a bit longer, so you're not having to constantly cream your hair all day. And then the second thing it does is it makes it look nice, because it gives it a nice shine. So,
and another thing is what we've always been told. I use a lot of gel. I use the coconut oil, but I actually use a lot of gel in my hair. And we've always been told that gel is glycerin, it's very bad for the hair. It hasn't been bad for me, but I know people who have used a lot of gel form products, and it's been very, very bad for their hair. It's
not that the gel in itself is bad, it's because it dries to the hair, and then it's harder to kind of comb your hair after, so then that kind of rips the hair out. So the gel itself is kind of like, again, it's water-based, but it has kind of drying ingredients in it. So I tend to prefer like a wax. But if you are, it's not the end of the world if you're going out to use some gel. I like to be kind of balanced with people, because I think if you're just kind of, you have to do it this way, you have to do it that way, it's it kind of puts people into a bit of a box. I can't do this, I can't do that. So I would say if you're going out on a special occasion, or you just want to look your best, use some gel, but just kind of, figure out a exit plan on how you're going to get the gel out of the hair. You might just rinse it out, or do it on a night when you're going to wash your hair.
Thank you so much, Natasha, for allowing us to consult with you.
Thank you very much.
Love the information. useful tips. So there you have it. Now you know what to do. And you, friend of mine who's obsessed with hair, your hair has a limit, okay? So respect the limit of your hair. So we're going to go for a break. And when we come back, we're going to continue on this topic, a hairy topic.
This program is brought to you by UCKG.